Hello, this is Dr. Jason Acevedo here to talk to you today a little bit about laryngoscopy. If you're watching this video, it's probably because you or your loved one has been scheduled to have a laryngoscopy. And this short video will just go through what to expect and how things should look. So a laryngoscopy, specifically a direct laryngoscopy, is a procedure that's performed in the operating room with a general anesthetic. And it's a procedure where I will look down your loved one's throat using some special cameras to get a better look at the lower parts of their throat, specifically the base of the tongue, the voice box, or the upper esophagus. The reasons this procedure is probably being done is either because you or your loved one may have a polyp or a nodule in your vocal cord that needs to be removed, if a biopsy needs to be performed to better figure out what's going on with a lesion in the voice box. Sometimes will be done to inject a vocal cord that's not working properly, say in the case of a vocal cord paralysis. There are fillers that can be injected into that vocal cord to help it work better and to help your loved one's voice and swallowing. And sometimes laryngoscopy is performed in conjunction with other procedures such as stretching the esophagus or repairing a pouch in the esophagus. Regardless, the procedures are very similar. And as I mentioned, you or your loved one would be completely asleep. You wouldn't have any recollection. You wouldn't have any pain or discomfort. And once you're asleep, that metal scope goes in the mouth. And then, depending on the specifics of the procedures, different tools may be used, graspers, suctions, to remove any mass or growth that needs to go. Or if an injection is performed, that injection material is injected through a very small needle into the vocal cord. Typically, these laryngoscopy procedures can take anywhere from 15 to 45 minutes, depending on how the specifics of the case are. And the recovery is very, very straightforward for a laryngoscopy patient. You know, typically after the procedure, you or your loved one would stay for the better part of an hour in recovery and then be able to go home. You would want to be kind of ginger with diet, you know, slowly advancing from soft diet up to a regular diet. You know, avoiding things that are spicy or crunchy just because those can be a little difficult on the throat. You will want to be cautious with using your voice after a laryngoscopy. I typically don't require patients have complete voice rest, but I do want them to use their voice pretty judiciously, and that would mean no shouting, no yelling, no singing, and no whispering. Whispering is actually very bad for your vocal cords. But outside of that, it is, like I mentioned, a very safe, very straightforward procedure. The biggest risks entailed with this procedure, one of them would be an injury to the teeth because the scope does go through the mouth. So if there's a loose tooth, it's possible to make that situation worse. It's also possible to have a chipped tooth. Fortunately, that's very rare. A little bit of pain is normal, usually more of a sore throat. A little bit of bleeding is not uncommon, so some bloody cough is to be expected. And really, infection is a very rare complication of laryngoscopy. So it's always mentioned, but fortunately it's not very common. So that should cover just about most of the questions you would have about laryngoscopy, and I'm looking forward to taking care of you or your loved one.